So in the practice management, what we'll do is, because we are having less time, from each of the panel, we'll just take 3 good points for the youngsters so that they can implement in their practice when they go back home. From all the panelists, 3 points from their experience, what is relevant to today's scenario. I think in that way we can sum it up nicely. Thank you all, the expert panel, for your wonderful insights. I think it was very useful. Thank you. I request Krishnamurthy sir and Gopal Raju sir to stay back for the practice management session. Madam, Sandhya madam, please join. Yeah, I think now I'll give it to Nandkishore sir. As we discussed, sir, I think we'll keep it to 3 points per person from their experience over this past decades. What is their message to young ophthalmologists who are going to start their practice? And we can then take.
I will probably like it more if it is general rather than restricted to IOL practice.
Correct, yes.
Good evening. We finally come to the last session of this wonderful CME program. Thank you, Madhu, and thank you, Dr. Raman Raju Garu, for calling us and having us over here. So, you can see from our gray hair that we have matured in practice and we are all old-timers. So it's a good thing for us to give some tips to the youngsters on how to go about their practice. We have been very lucky that we have come in in a generation where individual practices still survived quite well. But I think the scenario over the last 3 or 4 decades has changed dramatically. So my 3 points to the youngsters who want to start practice is, as soon as you are in the final year of post-graduation, you identify a couple of your very good friends who are dependable, whom you can trust for a long time, to come over and join with you. And then probably each belonging to a different subspecialty, so that you can. I think the best option for us is to go in and have a group practice. In our own personal experience, we have been very successful in running a group practice of LASIK for the past 25 years, where we started off with 10 and probably now we have more than 30 surgeons coming and operating there. Nobody has any complaints. The second point I wish to tell my young colleagues is that whenever there is a complication in your surgery, try to be very, very honest with your patient. We normally try to push it on to your some other cause which has led to the complication. You don't like this patient going to another doctor and the doctor telling that your doctor has goofed it up. So it is better to be honest. The patients, though initially they are very disturbed and very violent, still will come rally around and listen to what you want to say. My third point is that never push anybody for a premium surgery. For example, when we started off with LASIK, we had only blade LASIK, so we were left with no option. Once we got femto and smile, my principle has been that I explain to them the pros and cons of each of the procedures. But with the rider, that I tell them at the end of 3 months, the vision you get is just the same. These procedures cost this much, so it is left for you to decide which procedure you want. And believe me, about 7 years back, I used to do mostly blade LASIK. in the last 4 years, I've done just 3 blade LASIK. So it is, the patient can understand the benefits and he would go for whatever you feel in your hands is best. But don't push him towards it, because once you push him, then they are likely to catch your neck once something goes wrong.
Good evening, everybody. First of all, let me thank Dr. Madhu and Raman Raju garu to ask me to participate in this session. To be a successful practitioner, it is a multi-talented factors. As Dr. Nandakishore told, you have to identify the geographical area where you want to practice when you are in postgraduate itself. And also now with the subspecialties, you have to identify also the subspecialty and try to excel by doing fellowships. And the most important factor is the talent. Most of the people who reach that level are definitely talented. Nature or God gives the opportunity to the talented persons, but it is the confidence, consistency, and character that makes a person successful. So doing a honest practice with empathy and sympathy is the basic rule for a successful practitioner. And the other important things are, as Nandakishore sir already told, when there is a complication, you have to tell every possible thing to the patient. The patient or the patient attendants must be aware of the complication and try to rectify the complication. If it is not done by us, immediately refer to the person who can tackle it. The other point is, always see the patient when he is going out of your chamber with a satisfaction or a smiley face. So these are the things which makes definitely a normal practitioner also becoming a successful practitioner. But unfortunately, now for the youngsters, there is a rat race going on. And people like Nandakishore sir, who has done his medicine in 70s, is still practicing. And we are all still practicing, including Dr. Gopal Raju and myself. We started in 93 or 92, I think, Vishagai Hospital. And another most important factor for the youngsters, challenging factor for the youngsters is the second generation and third generation people are coming. So it is very difficult for them to compete with 30 years of experience who is their colleague only. Because 30 years of his parents are the second generation people have got the benefit. So considering all these things, I think the next the problematic factor for the budding ophthalmologist who wants to practice is the investment. They have to cut short the EMIs which they have to pay. Otherwise, they have a lot of pressures on them, and the financial pressure is one of the worst possible thing that depresses you. I think with all these, I think probably it is a great challenge for especially this generation of people, and with the gadgets are now highly costly, and the practice is not that lucrative compared to what it was. And I was telling yesterday, we took off the flight in 90s when the P.V. Narasimha Rao government has given concession for the customs regarding the equipment, it's a vision saving equipment. And at the same time, the IOL has come into existence. And our senior professors, our senior people were at the verge of their retirement. So our generation was very lucky. We have seen both ends of the profession. And now it is very challenging for the youngsters.
I'll speak last. Good evening, everybody. Just I would like to share some of my experiences. That is, previously when we were postgraduates and when we started practice, we used to do refraction on our own without depending on the autorefractor. As you know, autorefractor has its own limitations in some of the cases, like classic cases or so. So, one should be well versed with the refraction. However much good surgery you do, final outcome and final result depends on the how best you can do the refraction. So totally don't depend on the optomes. Whenever there is no improvement, you involve and try to do refraction and get the best visual correction. That is number one. Second one is, there are certain indications where we use steroids for short term or long term due to various reasons, like allergic conjunctivitis or post-operative, or in cases of lasers. So, to my surprise, after seeing some of the cases during post-op, I found there is no improvement in the vision, at least 2 to 3 lines drop. And when I checked the IOP, it is high. That is, means they are steroid sensitive. So I made it a rule to see all the post-op cases before giving final prescription. I had missed to see the IOP. Then only I will give final prescription. That adds to and we are not likely to miss. That is one. Another thing is, when there is no improvement, fine posterior capsular opacities also play a role in some of the cases. So, if we can devote some more time towards the examination, thorough examination, so that simple technique of posterior capsulotomy, it increases the vision by 2-3 lines. These 3 tips I would like to tell to our colleagues. Thanks for the opportunity.
Raman Raj Garu, thank you for giving us this wonderful opportunity. And congratulations, Madhu. You did a great job. Actually, the era when we started practice and this era is totally different. So I do not know whether we are competent to give any sensible advice. As Nandakishore sir said, always be honest to the patient and don't try to push him too hard. And don't be in a hurry to start practice. Take time in developing the skill. Observe from a senior successful practitioner and learn whatever is good you can take from. And also there is a saying that the person who wakes up early and goes to work early is always successful. So work hard, be available to the patient all the time. And this is a highly competitive environment. I advise all of you to be kind to your professional colleague. Don't make any unnecessary comments on your professional colleagues. Do the work in the best interest of the patient. Thank you.
Thank you, Ramanaraj sir and Madhu Uddaraju for including me in this panel. I am not a private practitioner and probably I may not suit this stadium also. But I was a professor who worked for 35 years and I did a very simple practice from 5 to 8, only in the evenings. And I have a very restricted practice. I see only 20 patients per day, that's all. We are 3 in number and we see only a maximum of 25 probably. And only 3 points I would like to say is, be honest to your patient. And that fetches you more number of patients. The faith you create for your patients is the one which is going to last long till your lifetime. The second one is, whenever you do a mistake, agree that. So agree your mistake, and when you cannot manage that, send to your friend. The third one I would like to say is, never comment bad about your colleague. And that bounces back and reflects your image, not your colleague's image, but it reflects your image. And thank you very much, sir, for giving me this opportunity.
So good evening. At the outset, I thank Raman Raju Garu and Madhu for including me and making me part of this particular wonderful CME. So after hearing the advice from the stalwarts, there is nothing left. Only I wanted to, today from morning to evening, you have been seeing the Dr. Raman Raju Garu and Dr. Madhu. See, that itself is an inspiration for all of us. So at that age, Ramana Raju, and with all the influence of the Ramana Raju acquired by the Madhu, with all latest technological advantages, and he is doing excellent work, So as an academician, as a family man, you have been seeing, watching how nicely he is managing the things. So down-to-earth persons, so always cheerful. As is the father, so is the son. So almost Yada Raja Tada Pradala, Nautune Unnaru. Tellavari, everybody see, if anybody is looking at their faces, always cheerful there. So like that, these are the important things, for the patient. The patient comes to you, if you are very serious, definitely they don't like to sit there. They don't want to tell their complaints also. That's why you must be receptive, always. So first call the patient by name. That itself is a big plus point to the doctor. Call the patient by name, and then you listen to them. Whatever they say, you carefully listen. Don't interrupt their complaints, because majority of the patients, especially post-operatively, they come to us for a second opinion, third opinion, something like that, pre-operatively, post-operatively. So you have to listen to them, their complaints. Then only they will be satisfied. Then you can take over, and then you can command them, and you can instruct them, you can do whatever advice as per your clinical judgment. And then, as Sanjay already told, never comment our superior, whatever they perform nicely or badly. Don't say anything negative, no negative comments about our own colleagues. That goes a long way, And if anything goes wrong, you try to protect them. Don't say negatively. And another thing is, you accept, suppose their lens drops, you explain them, this is the situation because of some weakness in the capsule, there is a lens has dropped, and then you try to explain everything to them openly, and then send them to your own retinal surgeon or something like that, and if possible, you send your persons accompanying them, and then so that they will get the things done by the expert surgeon. That's why explaining to the patient is very important. Whatever minus things which happen, which are going to happen to us, accept them, explain them, convince them, and then definitely the patient will listen to you and will accept the things also. These are some of the clues, So this goes a long way, and try to be modest and try to be honest to the patient. That is the important thing. So with this, I once again thank Madhu and Raman Raju Garu for giving me this opportunity.
So that was the wonderful advices from the seniors. These are all the valid points. So before coming to my 3 points, See, now because of the availability of the technology or the machinery or the diagnostics, and at the same time, the kind of the training which the ophthalmologists are coming out, see, more or less the standard has increased and the standard of care is more or less guaranteed. So now the issue in the current situation is more towards the expectations and services towards the patient. Those three things, the three things which one should concentrate. One is their experience right from taking the appointment to the completing the examination or procedure. Their journey in this process should be seamless and should be easily accessible, and it should be suiting to that situation. Maybe a situation in Bangalore is, Hyderabad is different from the other places. And it is entirely different in places like where the Apparao practices. So you need to address to the community which you are serving. So services are the most important thing now, where the high society, maybe you may have to create more good ambience, or in the other areas, then you may have to cater minimum services. And at the same time, we should be catering to the most of the majority of the society or the community. So number one is services, everyone needs to be improved. Number two is once they, in their journey, our systems needs to be established. Once they come to the hospital, the way of registration, then the examination process, and then the counseling process, and then if it is a procedure, and the way you counsel, like all these points, all our seniors said, the transparency, trust, listen to them, all these things really fit into that. So in other words, it's kind of a professional management which is more important nowadays. So these two, apart from these two things, once you passed out of your training, that is not the end of it. Earlier days, that works for another, your entire professional life. But now, whatever you acquire skill may last only for 4 to 5 years. Afterwards, a new procedure will come, a new technology will come. So you need to constantly upgrade your skills. That is why they changed the continuing medical education into professional development programs. So you need to be updated constantly. Not only yourself, your entire team needs to be updated, right from communication skills to the professional development. So these are the three most important things which needs to be added to your routine, professional or the earlier work. This is my advice to all the youngsters, all the existing people need to be applied these aspects to their original practice. And thank you very much, sir. We wish to meet you again in your 50 years of celebration. Hopefully by that time, Madhu will reach 25 years of his practice. So we'll club to both the Silver Jubilee and then the Golden Jubilee. We wish you a great, healthy, prosperous year ahead, sir. Thank you. And Vishnu is very clever, so he speaks at the last. So younger generation can learn from him.
I may be a little more practical. Thank you, Raman Raju. Thank you, Madhu, for giving me this opportunity and conducting this, such a professionally conducting this conference. The CME is applauding. And my experience and my opinion on the 3 tips for a practitioner, all these elderly people, they told very, very, very important points, but I will add some more. My 3 points are, my first one is group practice. Go for group practice. There is no place for solo practice in the future. Even if there is a place also, I don't advise. Why group practice is, in the so much of technology and so much of procedure, so much of specialty, nobody can master it alone. But patient needs all this technology and all this expertise. Patient needs. But as a single person, you cannot deliver. You cannot, anyway you cannot deliver. You cannot expertise, you cannot deliver. Time is not there and your resources are not there. So you have to go for a group practice. Group practice, there are different models. My model is a proprietary model. I am the proprietor and all my group are my colleagues. And there is a partnership model. I think Gopal Raju's model is something like a partnership. I don't know exactly. And other model is, this corporate is also comes as a group. And problem with this something like a Maxi Vision, Agarwas and all these there are other model of groups. This corporate model problem is you are working under some investor or some entrepreneur. So doctors usually, if I scold my colleague, he will accept me. But if somebody scolds, other non-medical person scolds me or advises me, I will not accept. That is the egos doctors are born with, are trained with. So try to form a group. Whichever these three formats of group, better is, that's difficult thing. 3-4 of people join, form a group, something like a cornea, retina, glaucoma, oculoplasty specialists, join together and form a group and establish your practice. Otherwise, most of the times doctors are also egoistic, they may not unite, that is the problem. So one of these three group practices you have to adapt. That is the order of the day and that is the future. And the advantage of this is, in my group practice, sir, there are 3 practices I have taken over. I have given exit way for my senior doctors. Those who they want to exit the practice, and they exited. I took over those practices with a good financial exit. Otherwise, they have to lock the door and close their hospitals. So that is the advantage. In the future also, if you are in a group, if you can exit with some resources with you, that is the importance of group practice. Second, this is the first thing. Second thing is practice evidence-based medicine. You need to practice, no subjective things. See, we are in the panel discussions, no 2 doctors told in anonymity of a single method, single thing. They differed in all these things. That is not the science. So go for evidence-based medicine, develop protocols, follow the protocols, and it takes a lot of time, lot of resources. So many things doctor need not do. The doctor is the leader. So you develop a protocol and develop a good paramedical team. They do most of things. That is less expensive and you are more productive. So always do evidence-based medicine, where there will not, the error rate of diagnosis or treatment will be very, very less if you practice evidence-based medicine, but that's costly. But if doctors do, it is costly. If paramedics do, it's not that costly. So develop a good paramedical team and do the practice. That is my second point. And the third point is, most of the solo practitioners work for 16 to 18 hours, some people. That is not at all advisable. That is not at all right also. Everybody has a limit to work, but we stretch. I can say we are a little bit greedy. So don't work for more than 8 to 10 hours. Share with your friends, share with your colleagues, and spend enough time with your family, with your kids, and with your hobbies. That is the life. Live the life, don't just practice. Don't go after money. And other thing, to make money most out of it is what I earned. My experience, 75% of my earnings I invested back into the hospital. So what is the point? So if 4 of us together invested, there is no need for me to invest so much of money. I should have saved a lot of money. So share your resources and spend. So then there is no need to work hard that much, 10 to 12 hours. After 10 hours, if you are working, the quality of work is not at all good. So work as per the biological and standards, 8 to 10 hours per day. Rest of the time spend with family or with your friends, or with live your life. That is my very, very important advice. And one more practical advice I want to tell you. Doctors, as a doctor, you are experienced, particularly ophthalmologists, we are ophthalmic surgeons. So, what most of us are doing is, if we work for 12 hours or 12 hours, 9 hours we are working in the outpatient, 3 hours only we are working in the theater. How much productivity you have in the OPD? In 9 hours, if you see 90 patients, 90 into 500, 45,000, you may get it. But if you do one surgery in 15 minutes, you may get that 45,000. So, you spend most of your time in theater, less time in the outpatient. To make that happen, you depend more on paramedicals, and senior surgeons should be in the theater, junior surgeons should be in the outpatient. Yeah, this is my concept of practice after a lot of experience. I'm practicing it, I'm experiencing it, I'm enjoying those luxuries also. Thank you very much. Thank you, Madhu.
Yeah, thank you everybody for these wonderful inputs. As a final point, the whole idea of we practicing and earning money is for the sake of two things. One is for your professional satisfaction. The other one is to keep your family happy. So most of us, I feel that in the process of earning money and building up a professional reputation, you're forgetting the family. So always try to balance your professional and personal life. Keep them as happy as you are in your clinic. Thank you all.
Thank you, sir. Thank you.
1 minute,
Now
sir.
I request, sir.
We have already tackled the Google doctors. Now we have to tackle the AI doctors now. I think the challenge is for all of us the next 10 years is tackling the AI.
Sir, I request Ramanraju sir to give mementos to Dr. Vishnuvardhan sir, his close friend, Sriram sir, and also Nandakishore sir, who didn't receive the mementos. Please. Sriram sir. Photo amma, twaraga. I request all the pharma people to be ready to the gratitude thing. I think it was a wonderful session because it's recorded. I think we can share these links to all of them who could not attend also. Yeah. Vishnu. Here you go. Next to his intermediate friend, Dr. Vishnuvardhan.
What I wanted to tell you. Since 1973, we are together. That's why I'm more qualified to receive this.
Thank you. Thank you one and all for staying patiently till the end of the session. I thank you for being there and contributing actively to all the deliberations.